Lakeland Currents, your public affairs program for north central Minnesota. Production funding for Lakeland Currents is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org. Closed captioning for Lakeland Currents is sponsored by Nisswa Tax Service, tax preparation for businesses and individuals. Online at nisswatax.com.
Hello again. I'm Jason Edens, your host of Lakeland Currents. Thanks for joining the conversation today, and thanks for your ongoing support of Lakeland Public TV. Folks, before we get started today, I just want to give a huge shout out to my gracious hosts here during the COVID-19 pandemic. As you all have noticed, we have not been doing these sessions in the studio, and unfortunately, we have not been able to have guests at the station. So as a result, I've been coming to Pine River to the Hunt Utilities Group campus, where Mr. Paul Hunt and Ms. Lynn Hunt have been gracious enough to allow us to record these at their campus. So once again, I just want to give a huge shout out of gratitude to Paul and Lynn Hunt. Thank you so much once again. Friends, you may not know it, but in all 87 counties in the state of Minnesota, the State Health Improvement Partnership Program is working on your behalf to ensure your health and well-being and reduce chronic disease. Here to help us understand more about the program itself, as well as how it operates here in our region, is Simon Whitehead, the director of the State Health Improvement Partnership Program in Cass County. Simon, welcome to the program, and thanks for making time for us.
Good morning, Jason. It's a pleasure.
So what exactly is the State Health Improvement Partnership Program? To be honest with you, before I met you, I actually was not aware of the fact this work was being done in our county, and I was also not aware of the fact that it was being done all across the state. So what is it?
Well, the big picture for the State Health Improvement Partnership is to increase the access and opportunity for all populations to eat healthier and get physical activity. So especially underserved populations. So whether that be providing a community garden for people who live in apartments, or whether that be a free community meal in Bacchus, or whether that be providing rollerblades for kids in Pillager who would not otherwise be able to afford them. That's the basic premise. Get people moving, get people eating healthier, and try to move the dial a little bit on the public health and obesity, especially, and smoking and that kind of thing.
Okay, so it sounds like you mentioned some of the work that you're doing specifically in the county, and I'm really interested to explore that. But just before we go there, do all counties have a director like you? Does each one of the 87 counties, do they have a SHIP director?
Yeah, they do. And some of the counties are collaborations between 2 or 3 counties. Mm-hmm. They're like health boards, which include 2 or 3 counties, North Country, and then the one over by Fargo and Otter Tail, etc. So they have SHIP coordinators like myself doing the work, but it's not always one county. Sometimes it's a collaboration.
Okay. Well, now that I know that there's a coordinator in most counties, does each coordinator have a lot of autonomy, or are you really given a lot of directives from the state in terms of what you can and can't do as the SHIP coordinator?
Well, there are defined strategies, and for instance, I'm working on a lot of strategies in Cass County. Bigger populations, the SHIP coordinator would maybe only work on healthy eating or workplace wellness or active living. I'm kind of working on a lot of strategies. There are some strategies I'm not doing right now because you just can't do every one of them. So I'm kind of prioritizing what I think we need here in Cass County.
Which is what?
Well, definitely active living, definitely healthy eating, workplace wellness. I'm on school wellness committees. We're doing some stuff with tobacco cessation because in the northern part of Minnesota, there's a prevalence of smoking is more. I'm doing stuff on community engagement, just getting on a lot of committees and telling people what SHIP is and how we can help, and letting people know they can call us if they need mini grants or whatever. I'm working with healthcare, falls prevention and dementia strategies. So those are the ones that I'm really working on. I've actually done quite a bit with the healthcare because we do have a fairly significant proportion of people over 65 up here in Cass County, and yeah, so pretty much the whole spectrum from kids all the way up through to seniors.
So I guess I'm hearing you say that the program is really sensitized to the county needs, and the onus of responsibility of figuring out what those needs are is on you as the coordinator, right? You have to do some sort of
Sure.
assessment in order to figure out what the county needs. Is that right?
Yeah, we do a community health assessment
Okay.
that the Cass County performs.
Mm-hmm.
And looking at that assessment, we then meet and prioritize what we need to do. And then the ship coordinator uh, uh, goes off and starts working on those strategies with the community. One of the things I've tried to do since I've started, this is starting my third year now, is get out in the community, meet people, get the trust. Uh, it's okay to send them an email, to send them some forms to fill out, but if you sit down with them, explain everything, and listen to them to see what they need, it's a lot better than just emails and phone calls. So
Sure.
I've actually spent a lot of time getting out to different parts of Cass County, meeting people, uh, trying to figure out what they need, and proceeding from there. I should
Yeah.
also wanted to add, Jason, that you might notice that I'm wearing a University of Minnesota Extension shirt, and I am actually an employee of the University of Minnesota Extension, which I think is a big plus because um, I not only have the resources from Cass County, but I also have the resources from the University of Minnesota to call on when I need them. Just as an example, we've been doing all our meetings with Zoom, and
Mm-hmm.
the University of Minnesota have provided me with an account for Zoom that is doesn't limit the participants or the length of the video, and so
Mm-hmm.
that's been extremely useful in being able to set up meetings and still meeting with people during the COVID situation. So
But is the State Health Improvement Partnership Program part of the University of Minnesota, or is it part of the Minnesota Department of Health,
it's
or both?
part of the Minnesota Department of Health.
Okay.
Um, Cass County was not able to, at one point, find a ship coordinator.
Mm-hmm.
You stepped in and aided them in helping them to find a ship coordinator. The U is also very involved in the SNAP Ed program. So uh, providing SNAP educators in this region. So it wasn't that much of a stretch to help them with the ship coordinator situation. Yeah.
Okay, so we got a lot of acronyms here. I want to make sure that our viewers are
Right.
tracking with us. So you said a SNAP educator. That's different from a SHIP coordinator. What's
Right.
a SNAP
So the
educator?
SNAP Ed is what they used to call food stamps, the food
Mm-hmm.
stamp program. So it's the supplemental nutrition assistant program. So basically, and not many people know this, but the Cass County has the highest number of SNAP Ed recipients per capita in in the state. So there is a big need for nutritional backup in
Mm-hmm.
the state. We also have one of the highest rates of unemployment right now per capita in the state. So there's definitely a need in Cass County,
Mm-hmm.
and yeah, that's the acronym. So basically, if you know SHIP and SNAP,
We're,
that's all I'm
we're
going to
good.
use today.
Okay. So you talked a little bit about this needs assessment, and you talked about the fact that your preference or your style, if you will, is to get out into the community, to hear from people, to hear what they need. But that sounds like a really organic benchmarking process, a really organic needs assessment. I mean, how do you determine what the actual health needs of an entire county are? Is there a formal tool, a formal
Well,
assessment tool, or is it that organic?
well, there is a survey that goes out,
Mm-hmm.
and that's the tool we use. But that's just a starting point, really. That gives us kind of a big picture, and to really find out what communities need, you have to go and meet them
Mm-hmm.
and to talk to the people. Um, a food shelf, for instance, which I've created a food shelf coalition with all the 7 food shelves in Cass County, and they never used to talk to each other. And now they meet once a month, and we discuss common issues, and we network, and we share resources, and we support each other. So, but in order to do that, you have to meet with people, sit down, get their trust, and listen to the things they need. I'm not going to know that Cass Lake Food Shelf needs a freezer
Mm-hmm.
unless I really understand the fact that they're borrowing a freezer from the food distribution center next door, and every time they want to have something, they got to go next door to the food distribution center, which is only open certain hours. So every situation is specific, and you need to understand the situation by talking to the people who are there day in day out.
Mhm. Well, it sounds like you're a real boots on the ground guy, if you will. Are your peers in the ship community as hands on? And I guess I'm curious to know how different your program approach is here in Cass County as opposed to other parts of our viewing area, Beltrami County, Morrison County, Crow Wing County. Is what you're doing unique?
Well, I don't think so. I think the ship educators are extremely resourceful and creative and boots on the ground. I think that's
Mhm.
something that I've learned from other ship coordinators. Is this is the way to do it.
Mhm.
We meet with the ship coordinators from Beltrami County, Itasca County, and Hubbard and all the other ones in our region. And we have I think it's a quarterly meeting, and there's other meetings that on a state level where we meet, and that's the style I think that I've seen predominantly throughout the state is getting out there in the community and meeting people and listening to them and figuring out what each community needs and getting stuff done.
So it's a very hands-on program statewide.
I believe it is, yes.
Okay.
Yeah.
So let's talk a little bit about some of the specific work that you're doing here in Cass County. I hear about the work now of the ship program in Cass County quite a bit. You alluded earlier to rollerblades for kids in Pillager, I believe. Let's start there. What's an example of a ship program?
Let's talk about active living, which is
Okay.
increased opportunity for walking and biking, especially. So one of the first things I did is I got on the committee for a bike friendly Walker. So Walker wanted to become a bike friendly city, increase opportunity and access and safety for walking and biking in that city. I worked with the chamber, the city of Walker, the biking community, the businesses, and over the course of about 16 months, we were able to apply to the um, uh, American Alliance for Bikes and become what they call a bike friendly city, a bronze level bike friendly city, which means we're on a list. The Walk is on a list now, a national list for people who like biking to come, knowing there are trails, there are trailheads, there are uh, bike repair stations, there are bike repair shops, there are trail maps, there are hotels and places that they can stay at and do a lot of biking. And as you know, we have a great trail system for biking in Cass County with the Paul Bunyan Trail,
Mhm.
Heartland, and the Chincombee Connection. So that was one thing that I was able to do. I was able to to get a grant through SHIP, about $27,000 to buy a bike fleet and a trailer for the 4 school districts in Cass County that are in my jurisdiction. And so now we have a 32 fleet, uh, bike fleet, and a trailer, and we used local people to provide the trailer. It's also got a special needs bike in there as well, and unfortunately, it hasn't got a lot of use yet because we only got it up and running about a year ago, and then it was used in the fall, but of course, it has not been used in the spring
Mhm.
because of the COVID situation. But we've done the training with the teachers, so all the teachers know how to use the bikes now. There's a curriculum for them, and we hope that school districts will, and in the summer, community eds will be able to use the bike fleet. We've encouraged bike events. Uh, we were going to have an event this Saturday actually called the Spring Bike Fling.
Mhm.
Um, kind of we're trying to base it on the one they have in Bemidji, the Loop the Lake one,
Mhm.
but they have about 700 or 800 people show up, and where we haven't obviously been able to get that off the ground because of the situation. There are like 5K events which we've uh, started in Pine River and in Hackensack. Okay, we're going to have one this spring called the Furry 5K. Uh, and Walking clubs are something that I'm going to be starting where people can meet at a coffee shop. There'll be a sign. They can meet with friends and go for a walk. It's much more um, fun to go for a walk with someone than by yourself. So we're just trying to encourage walking in that way. We're supporting walking trails. There are various people that have walking trails, like the tribal college. We provided signage for them so that people actually know where the trails are.
Mm-hmm.
Uh, Paws and Claws and Hackensack are going to have hiking trails. We're going to provide signage for that. Also in Hackensack, there are hiking trails and a recreation area, which no one really knows about in the reserve, and we've provided signage for that. So anything that allows people access to exercise, um, that's part of our active living strategy.
Well, you've talked a lot about active living, but there's also a focus on local foods, right? Now, before we
Right.
talk about some of your work with local foods, you mentioned just a moment ago a grant that you got from SHIP, the State Health Improvement Partnership Program.
Yep.
Why do you have to get grants from the very program that you're coordinating? I don't understand that funding part.
Sure. So there's an amount of money based on your population, which is given to each state. And
Mm-hmm.
from that money, the ship coordinator is paid, and the remaining money is allotted to grants and mini grants. So a mini grant is $3,000 or less, which I can process with my supervisor in Cass County, and anything above $3,000 has to get cleared by the Department of Health, and I have a specialist who I work with in that regard. So if you think about it as a total pot of money from which the ship coordinator gets funded, there's a few support people in the office that get funded
Mm-hmm.
through it too, and then the rest of it kind of goes to mini grants. That's
Okay.
what I do is I coordinate the mini grant process with the people, the groups in Cass County that are
Mm-hmm.
applying for mini grants. Like
Mm-hmm.
for instance, if we were going to start talking about food, we have 7 community gardens in Cass County now. And the whole idea is we want to bring back community gardens because we think it's great exercise. It's a great source of nutritious food. It's a source of community pride, and it's something that we will support with a mini grant. A good example would be like Bacchus and Hackensack, who
Mm-hmm.
this spring have brand new community gardens. They applied for a grant through the SHIP program. They were allocated a grant to buy fence posts and fencing and sheds and some tools. What I do is I help to energize that community into getting a group of people together that want to do this. And after um, this is the group is formulated, I help them in the beginning processes of getting started with the community garden, with the funding and with the organization and so forth. So then what I tend to do is I tend to step back and let that local group take over.
Mm-hmm. So once you've planted the seed, so to speak, what's the uptake on, or what's the germination rate on, in terms of people actually using the community garden? So you've got this community garden now in Hackensack and Bacchus, I understand. Are
Right.
the plots subscribed, or are they?
Sure. So what
Okay.
we do is once we know that there's a viable garden there, we'll advertise in the paper. We'll make flyers. We'll post it. We'll make each of those gardens has Facebook pages, and we will get the word out that there is a garden. We'll go to churches and legions and community meals and distribute flyers to say, hey, we have apartment buildings, and say, hey, we there's a garden in Bacchus. I don't know if you know that, but there's a garden here now.
Mm-hmm.
Um, and if you drive down 371, you will see the garden just south of between the Lutheran church and the garden center on 371 to the right going south. And it's got a big sign, which they had NEI provide a sign that says community garden. And so it's pretty obvious where it is. The Baptist one is not filled yet. The Hackensack one is almost filled. The one in Walker and Pine River is full. The one in Pillager is full. And this evening, I'm going out to Rima to try to help them with their garden out there. So, yeah, but community gardens are making a comeback.
That's really exciting, and it's really exciting to hear that's part of your work. Now, another aspect of your work that's related to food is something I believe you call community meals. Why don't you tell us about that?
Well, at the beginning part of last year, I got a phone call from a social worker saying that actually a federal shutdown going at the time, and some checks were delayed, so people were not getting their monthly checks, and they were going into the social worker saying, "Well, I've got to either choose food or rent," and we thought that was kind of wrong. So we knew a chef called me and said, "Well, we have extra food," and Christy Miller from Trout Lake Camp says we're throwing food away at the end of the week to make room for the new food coming in. So why don't we just try and get that food, rescue it, the good food that can be used
Yeah,
again,
of
and
course.
make a meal. So this started off with 2 or 3 people sitting around a table, and then we brought the Pine River Bacchus Family Center in with Leslie Bougeronville, and she kindly took us under her wing. We got a grant from SHIP for about $3,000 to buy a refrigerator, to pay someone for the first 3 months just to kind of get it going to organize these meals. And we found a wonderful site coordinator called Brian Sheffy, who is a wonderful chef. And he goes around and collects rescue food from local restaurants, puts it together into a meal. So we had a meal on Monday in Pine River and a meal in Bacchus on Tuesday, completely free, no donation plate, nothing. Started off with 20 to 50 people coming, and now we regularly get about 650 people per week. We've done over 20,000 meals in a year. So
Oh my gosh.
yeah.
You have 600 people attend these community meals.
So last week we had about 250 at the Pine River location and about 420 at the Bacchus location. And of course,
Just
right
last
now,
week? I'm sorry, I
just in one week. Yeah,
interrupt, but just last week.
yes, just in one week. Yes.
How are you doing that during COVID? I don't understand how that's
Well, we're doing curbside pickup, uh,
unbelievable.
takeout boxes. It's a lot of extra work, but the volunteers have been unbelievable down there. They've just stepped up completely, and Brian has been able to get food. So right now we're receiving a lot of donations
Hmm.
because people understand that the restaurants aren't open right now to give a lot of extra food away.
Yeah.
Resorts aren't open, and so we're spending money on food right now, but we have been getting some great donations from some local companies, and from the Legion and places like that. So we have the funding to keep going for a while until the restaurants open again. I think we just
So your argument, Simon, I'm
yeah.
sorry to interrupt, but your argument is basically that there's a lot of food insecurity, and by offering these community meals, you're elevating positive health outcomes simply by addressing food insecurity. Is that right?
Right. So some of the things we'll hear from the public, and we put comment cards out on the table so people can fill comment cards out.
Hmm.
But number one, it's a nutritious meal. It's a good portion. It's a sensible portion. We don't do many desserts and that kind of stuff. It's
Hmm.
mostly just a really healthy type meal with some kind of fruit in there as well.
Sure.
But basically, the kind of things we're hearing is a family comes in like, hey, that's one less meal I have to fund
Hmm.
this week. That's going to help me. That's 4 less meals a month I have to fund, and we have. I mean, we have the average household income in that particular area is around $23,000 to $24,000. And that's not a lot of money. I mean, there are a lot of people not working. There are a lot of people who have retired or just existing on Social Security.
Hmm.
So, um, one of the unforeseen benefits of these community meals is that it brings people together. Uh,
Hmm.
the volunteers, the recipients.
Hmm.
Um, there's a great atmosphere. You go to one of these meals, it's noisy. It's happening. We
People
got
are getting to know each other.
we got a lady called Vicky uh, Majerek in Bacchus who organizes all the volunteers all year round, and she's like 4 or 5 months ahead with the volunteer schedule.
Yeah.
And the way that they do it in Bacchus is you sit down at a table and they bring the meals to you.
Wow.
Well, you might be sitting there for 5 minutes with someone you don't even know because it's a
Hmm.
big table. And what do? You start talking, and
Sure.
they may even live on the same road as you.
Right.
Next thing you know, you've got a new friend. So there's been a lot of added benefits to the community meals, and we've really enjoyed doing them.
Well, I want to understand how your funding is tied to success. So, first of all, how do you even measure whether or not you're improving health outcomes? And is your funding a function of whether or not you achieve those health outcomes? Or are you going to be funded regardless of whether or not you achieve any change?
Well, the first 5 years of the SHIP program is going to conclude at the end of October this year. There's been a lot of hard conversations with the Department of Health about whether we are making improvements. Long-term studies have happened, and we are seeing some case-by-case benefits. I want to say that we're making a difference.
Mm-hmm.
I believe that we're making a big difference.
Mm-hmm.
The obesity rates is not going in the right direction, unfortunately. And I don't know if you can pin that on the State Health Improvement Partnership
Sure.
or just the way of life that we're living in the United States
Mm-hmm.
and in Minnesota. In my mind, if we didn't have the State Health Improvement Partnership, things would be even worse. We were below 30% obesity when I first started in this job, and now Minnesota is slightly above 30% obesity. So there's a lot of work to do. We don't want to cut programs that are helping people to get exercise and have eating better and quit smoking and that kind of stuff. So
it sounds like the need is still there.
the need is there, yeah. So, and it's hard to pinpoint kind of how we're doing. Maybe the 5 years that the State Health Improvement Partnership has been going, maybe in 10 years' time we'll see that delayed effect. Who knows?
Yep.
But I certainly feel anecdotally that we're making progress from what I can see.
Okay. Well, we only have 1 minute left, and I've still got a couple questions for you. So we're going to do a rapid fire round here.
Sure.
So you've mentioned Cass Lake on a couple of occasions, and of course we share the geography with the Leech Lake Band of Ojibwe. How do you work with the band? Because of course much of the reservation communities in Cass County.
Right, and the reservation, the Leech Lake Reservation, has their own ship coordinator, and so I work with that coordinator on joint projects. For instance, we brought someone in to talk about anti-vaping. It was a young man who almost died from vaping, and then their coordinator in the reservation brought this young man in. We were able to bring him down to Walker and talk to some of the students down there too. So that's an example of how we work together.
2 more questions very quickly. Has your emphasis or your focus changed at all with COVID-19? Very briefly.
Not really. The problems are still the same.
Sure.
I don't think it's changed. The way we deliver it is a little bit different now.
Okay. And finally, I want to close with a personal question, Simon. Is this just a job, or is this work important to you personally?
I didn't know a lot about the SHIP program when I came up and started this. I'm really into it right now. I love it. I look forward to my job every day because I'm meeting people. I'm getting to know the community people. I'm kind of an outgoing person as it is, and this job fits me perfectly. So for me, it's a personal project to improve health in Cass County, but it's also something that's really fun to do. For me, is.
Well, thanks for the work that you do, Simon, and thanks for joining the show today. I really appreciate your time.
Yeah, thank you, Jason, and good luck with your program.
Absolutely. And thank all of you for joining us once again. I'm Jason Edens, your host of Lakeland Currents. Be kind and be well. We'll see you next time.